Hello, 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 and welcome back. We are back on YouTube this week. Back to our normal, regularly scheduled programming, the way we normally do things around here. Last week was an incredible episode of a mashup of some of the speakers from the Women's Wellness Virtual Summit. And so I didn't end up making a video for that to go on YouTube, but if you really liked what you heard, then you will definitely want to join us next July when we have the second Women's Wellness Virtual Summit. So super excited about that. But this week we are going to talk about a topic that was listener and viewer requested by none other than my girl Sam Virga. Shout out to you. Woo woo. She wants to know about the laser hair removal products that are out on the market for home use. And specifically, she was looking at the Nood, Nood. So I did my due diligence, I did my research, and I found several studies that I'm going to share with you. And then I also compiled information from the website, from the company's website themselves. And I'm going to share all of that with you and then just kind of give you my thoughts at the end of that. So that, again, like I always say, you can choose to do what you wish with the information that I'm giving you, right? It's up to you as to how you move forward, whether you choose to use a product like this or not, right? The choice is truly yours. So we're going to, like I said, go into 3 studies. I'm going to share with you just the essence of those 3 studies, the information I pulled from them. And then we'll look at, like I said, Nood, the company itself, Nood, the one that she was interested in. Um, just keep in mind that most of these laser hair removal products are pretty similar. So what I'm sharing with you in terms of this specific product, when we get to that time today, is going to be pretty comparable to the other products that are out there on the market. Um, yeah. And then again, I'll wrap up, like I said, at the end with my thoughts. So let's get into it right meow. Okay, the first study I have for you is from NIH, which is the National Institute for Health. Um, they were looking at the Silken device, um, and they found that these this particular product, they had 22 female patients that were part of this clinical trial, and the patients received 6 biweekly treatments with the device. And then clinical results with hair count and pictures were performed at 4 weeks and then 3 months following the last treatment. From this, they found that 95% of the patients noted their hair count reduction at the end of the clinical trial. And again, I should probably back up that if you are like, what is this? These are those TikTok devices and what have you that have been in a lot of magazines too, where it is supposedly laser removal of hair, right? Instead of using a razor, and it's theoretically supposed to keep the hair away longer, so you have to shave less, okay? So they found that overall hair reduction was 78% at the 1 month follow-up and 72% at the 3 month follow-up, and there were no serious adverse events that were noted. This clinical trial, they claim, confirms the safety and efficacy of the device for hair removal at home. So that was the first study that I found. The second one is just kind of all encompassing, just these devices in general. It wasn't pinpointing a specific laser hair removal device. But they said that manufacturers really need to be keeping safety at top of mind when they're creating these devices, because these particular devices may be accessible to children, which, we don't want that to be the case, especially if the child does not know how to use it. Um, and also, people could be attempting to use them on unsuitable skin types without the full awareness of potential side effects. So, did want to mention that from their from their wrap up in their article as well. Again, the study also said that there are limitations with these devices that include the lack of hair clearance on darker skin types, and the low speed of treatment compared with professional devices that are, they're saying, a little bit more effective. And so these things, again, they're saying need to be put into consideration when looking at these types of devices and determining their efficacy. The third report is more focused on the health, like truly the health effects of these. So what I found was that these lasers, these laser therapy devices are using non-ionizing radiation in the form of a concentrated light source. And it's providing a fine laser beam, and these laser beams are used to kill the hair follicles, which results in the loss of hair growth from these follicles. However, they're saying that the laser therapy uses different ultraviolet or UV wavelengths to those found in sunlight, which would be UVA and UVB, or ionizing radiation, like nuclear radiation and X-rays. So they're saying they don't use those types of harmful rays, which are both known to cause damage to cells and cause skin cancer. They claim that non-ionizing radiation is safe for most, and that laser hair removal is safe for most. However, long-term effects of laser therapy, including the possible increased risk of cancer, have not been studied. But they said that laser therapy is safely used for things like cosmetic purposes, such as tattoo removal, dental procedures, treating varicose veins, prostate, skin, and eye surgery, removing kidney stones, treating cancer, including skin cancer. I don't know. I just feel like there is a lot of still unknown. It's one of those things where, like, we can say that we think that it's safe, but there's just not enough conviction for me that these things are safe. So when it comes to, am I going to have to shave less if I use these devices? Potentially, yes. But is it worth the potential health risks? And I say potential because there is potential. Is it worth the potential health risks in the near or long-term future? For me, that's going to be a no. Like, it's not worth it. They did say that some researchers have observed a change in atypical moles after laser hair removal. Therefore, they suggest caution in the use of cosmetic laser therapy for people with a personal or family history of skin cancer or atypical moles. But again, they say, however, for most, laser hair removal is safe. They also say that things like nail art, it's important to research about beauty treatments because things like nail art can also have some of these lasers as part of the treatment process. So it's really important to research and do your due diligence before proceeding with any kind of beauty treatment. So all that being said, Nood, so Nood, was FDA cleared. Okay, so it is obviously out on the market. It is sellable. And their study was done by Dan Friedman, Dr. Dan Friedman, a board certified dermatologist. And this study consisted of 40 people ages 18 to 45 over the course of 4 months. This was a third-party test that was done before and after clinical trial was designated to test the efficacy and safety of the Flasher 2.0, which is Nood's at-home handheld device. It said that participants were followed in clinic at a dermatologist office over a 16-week period. Each participant performed 10-minute treatments at home on a single armpit twice weekly for 12 weeks. And then they would visit the dermatologist office after 4, 8, and 12 weeks of treatment to measure their hair reduction and patient satisfaction. And then one final visit 4 weeks after at the 16-week mark from their last treatment. Okay. With that being said, they report a 92% overall participant rating of hair reduction as improved, much improved, or very much improved after just 8 weeks of treatment. So that's what they tout on their website. That's their claim. They also shared 97% of the participants reported moderate, good, or very good satisfaction after just 8 weeks of treatment. And in terms of discomfort level, their average rating was a 1, going from 0 being no discomfort to 10 being extremely uncomfortable. Their average rating was a 1 in terms of discomfort. Um, Again, like I said, their claim is that you've got permanent hair removal in 8 weeks. If you're interested, I'm just letting you know the deets. It is currently $200 for the device with a 30% off discount. They do say that they are dermatologist tested, they've got a money back guarantee, they are FDA cleared, and you get free shipping on the product. They have been publicized in Forbes, InStyle, Elle, People, Men's Magazine, Vogue, and Bazaar. So again, it's one of those things where yes, we see it. We want to, it's enticing, right? But I just keep coming back to, even though I am not someone who is going to conceive, I just keep thinking, if I were, would I want to be using this device if I knew there was even a fraction of a potential that it could harm my body and my potential child in any way, my future potential child? The answer is no, right? I would not want to use it. And just for my own being, as a child-free woman by choice, I would not want to use it because of the potential effects that could be there down the road. These devices are so new to the mass public, to in-home use purposes, that I just would not do it. And again, that's my personal preference, that's my personal stance on it. You may disagree, but someone such as myself who went through a whole lot of radiation early in her life because of the birth defect that I had when I was born. I had a lot of radiation to do scans on my head to make sure that I was developing properly. And my mom was really good about always having them cover up any part of my body that wasn't being scanned, that wasn't being looked at. But, there's still, like they shared, there's still lasers being used for things like dentistry, and whatnot. And again, we don't know the long-term effects of even that, because some of that stuff is newer technology. So, I just personally, looking at all of this to its entirety, it seems on the surface that everything is fine and dandy and safe, but just me being the precautionary woman that I am, I personally um, would not choose to go down that route and use this type of device. I wouldn't even go to a place to get it done. Um, because for me, you know what? I'm fine with shaving once a week. And even if the hair is too long, by the time I get to that 1 week mark, it's okay. We all have hair on our bodies. It is what it is. Um, Shaving is just a natural part of being a human. So that is my spiel on all of this. Hopefully, Sam, if you're listening, hopefully this is helpful to you. Hopefully it was helpful to anyone else who's considering these types of devices. I highly encourage you to continue to look at your own research as well that you find on these products. And I will put, actually, if you reach out to me, I will share with you any and all of the links for the research that I found. So if you want more insight into this and you want to look deeper and you want to see what I gathered research wise, just send me a DM and I will send you the links, or you can click the text message feature in the show notes, ask me to send it over to you, and I will. So Yeah, that is that. I hope you have a fantabulous start to your week if you're listening to this on Monday. If not, I hope you're having a great week. And I will be back next week with another solo episode. So until then, take care. Have a wonderful start to your day or rest of your day, and we will chat soon.